Hi guys, it's your nurse again. So, if you're in school of nursing or in the university studying nursing, I want to tell you some things they actually did not teach you in school when you're in the university or in school of nursing. When we are in school studying nursing or maybe in the school of nursing, we all were taught of how to give medication, to document correctly, you know, write your nursing care plan, survive your clinical posting. But there are some things they didn't tell us about the real life experience. Yeah. So after school, let me tell you something. In school, they didn't tell us how emotionally draining it feels when that patient you are trying your best to save dies. They didn't tell you that. You will be drained. You will feel like crying. And also, they didn't tell you that sometimes nurses will be so tired, they will be so emotional, they will have a lot in their mind, and they will go to their closet to cry, or even go to the changing room to cry. They won't tell you that. They won't also tell you how 24 hours shift will make your body feel so weak, even when your patient needs you. And you still carry that same body to go and take care of the patients when you're weak, when you're sick. They didn't tell you that. And they didn't tell you that sometimes, like I said before, we go into the closets to cry. Maybe something happened, but you're on shift, you're on duty. You can't skip your work like that. You will go inside the closet. You will go maybe to the changing room to go and cry. Yes. That's why when I hear some people saying, do nurses get sick? Yes, we are humans. We are like you people, we do get sick. They did not also tell you that sometimes patients and the patient's relative will even hit you or even abuse you when you know that you're trying your best to take good care of that patient. They didn't teach us that. They didn't even inform us or give us the hint that that's what we are going to be facing after school. They didn't even tell us how to balance, like how difficult it is for us to balance our relationship, our work, everything, like to balance our life. It's really difficult. It's actually draining. It's so difficult to balance our relationship, balance our lives. Yes, it's difficult. They didn't also tell you that sometimes you will skip meal because you are trying to take care of the patient. You even ignore your own body, your own pain, just to take care of the patient. They didn't teach you that, right? When you're done with school, you're going to face all this when you come out also. Yes. And they didn't even tell you that behind every smile, the nurse is smiling. You see that smile whenever you see us, we're smiling, we're smiling. How are you? How are you? Behind that smile, there is pain. There is pain, there's fatigue, there is stress. But we can't just come and show it to our patients unless you're actually not a caring nurse. But if you are, you know, one thing with us is when we come to work, we put all those behind because we have people we need to take care of. We have people we want to save. So push all those behind us and live like nothing happened. So all I'm telling you, those in school, in the university studying nursing, those in school of nursing, yeah. When you're done with that, the outside life, the experience outside that walls of your university, it's difficult. It's actually not easy. It's difficult. So just get yourself ready because you're going to see it. You're going to face it. But all I'm going to tell you is that there's one thing I believe in this life. When I'm caring for others, I feel, and I always use it as a point of prayer, that God is doing the same for me and for my loved ones. So just don't don't take all the things that your patients and the patient's relatives are telling you to heart. always remember, I need to take care of them. I need to make them feel better. I need to make them feel well and go home to their loved ones. Always see them as your loved ones. That's all I can say to you. So I'll see you guys in my next video. Bye.